Good morning, Miss. I'm Nurse Verlin. I'm in here to give you medicine and then give you some healthy tips for patients with high blood pressure and the last to explain some menu for patients with high blood pressure. Are you willing, Miss? Okay, Miss. How are you today, Miss?
I'm fine, Miss, but I'm little dizzy.
Okay, I'll check your blood pressure first, yes, Miss. Okay, and the result is 185, yes, Miss.
Yes, Miss.
And then I'm going to give you a medicine for high blood pressure, which is captopril. This medicine taken 3 times a day after eating, yes, Miss. And then I will explain to you about this medicine. Captopril is medicine that works for hypertension and heart failure. Additionally, it can also be used to protect the heart after heart attack, as well as treat diabetes in the kidney disease. Captopril will strain the production of matter in the body, which causes blood vessels to contract. That way, the blood vessels will be more relaxed, so that blood pressure go down, and blood supply and oxygen to the heart will also increase. And then dose and stabilize rules. Initial dose of 25 until 75 milligram. Divide into 2 until 3 doses. Doses can be increased to 100 until 105 milligram. Divide into 2 until 3 doses after 2 weeks surgical application. Side effect from captopril. The possible side effect during captopril are: number 1, nausea and vomiting; 2, vertigo; 3, diarrhea; 4, constipation; 5, disorder of appetite; 6, itching and rash on the skin. There's some explaining about captopril's medicine. Now I'm going to explain to you about some healthy tips for patients with high blood pressure.
Okay, Miss.
Healthy tips for patients with high blood pressure. Number 1 is configure diet. Through research conducted the National Heart, Lung, Blood Institute, or NHLBE in America. Hypertension sufferers are strongly encouraged to apply the ASH diet. There's the 3 methods are read as low in blood pressure and in cholesterol. So the risk of heart disease can be reversed. Number 2, weight control. Adding to the severity of hypertension condition, uncontrolled weight has the potential to bring in other diseases, for example, diabetes mellitus. If diabetes coincides hypertension, the trip of the disease will get worse and and those with hypertension find it difficult to improve their quality of life. For this reason, people with hypertension are encouraged to lose weight, bodies to the ideal rank. The weight loss of each pound is directly proportional to the drop in blood pressure of 1 mmHg. Number 3, regular exercise. Each hypertension sufferer is encouraged engage in regular exercise that can help to go down blood pressure. Don't forget to combine with exercise that exercises muscle strength at least 2 days a week. Number 4, manage stress. People with hypertension should avoid stress as much as possible. Even if stress, manage it well so that its effect can be avoided. You could try relaxation techniques such as meditation or sharing stories about problems with people close to you, and also make sure you have time to sleep at night. Now is 7 until 8 hours a day. And lastly, I will explain about good diets being consumed for people with high blood pressure. Number 1 is baked potato. Baked potato high concentration of magnesium and potassium, two nutrition which are important for DASH or dietary approach to stop hypertension, which serve to stop hypertension. Number 2, low fat milk. Low fat milk, also known as skim milk, is low fat milk. That milk is made by removing most of the water and fat found in the milk. A glass of low fat milk provide calcium and vitamin D, a nutrition that helps lower blood pressure from 3 until 10%. Number 3, broccoli. These vegetables are a good source of blood pressure because they contain magnesium, calcium, and potassium minerals. Three mineral deposits have a good reputation for lowering blood pressure. Broccoli contains many compounds that can help reduce arterial damage, causing high blood pressure. Number 4, oatmeal. Consumption oatmeal can go down systolic blood pressure and diastolic. This may help to maintain a healthy weight and to prevent obesity, which is a risk factor in high blood pressure. Number 5, white beans. Lowering blood pressure more than just reduce the sodium. Also, it is necessary to consume 2 of 3 high food, calcium, magnesium, or potassium. Well, the white beans contains 3 of the minerals. A bowl of white beans contains 13% of calcium, 30% of magnesium, 24% of potassium needed for the recommendation daily serving. Well, that's an explanation from me about medicines, about healthy tips for high blood pressure, and about some menu for patient with high blood pressure. Do you have any question, Miss?
Nothing, Miss.
Okay, if nothing, I left to go back to nurse station, yes, Miss. And if you need anything, press the nurse call beside you. Thank you, Miss, for your time. Assalamualaikum.
Okay, Miss. Thank you for your explanation, Miss.